millions of Americans suffer from vein disease, and it's not just a cosmetic issue.
To better understand vein disease and what treatments are available, we sat down with Dr. Sanjeev Pradhan from Vein and Vascular Experts. Thank you, doctor, so much for being with us today.
Thank you for having me here.
So can you share with us what sort of medical problems does a vascular surgeon treat?
Yeah, sure. As a vascular surgeon, I treat multiple disease processes that affect arteries of the body, such as carotid artery disease, which can give stroke, aneurysmal disease, which can sometimes lead to abnormal dilation of arteries, which can then burst, peripheral artery disease, which causes blockages in the arteries of the legs, which can result in symptoms such as pain in the leg with walking or gangrene. And I also treat vein disease as well.
So what is vein disease?
So vein disease is the process that leads to varicose veins. It's actually very common. It affects about 1 out of 5 Americans. It's usually caused by genetic factors. It's hereditary, so it runs in families. But others that are at risk include people who work standing for long periods of time, sitting for long periods of time, and of course women who have multiple pregnancies are at high risk as well. And varicose veins are just one symptom of vein disease. Other symptoms include tired, heavy, throbbing, aching, fatigued feeling in your legs, particularly at the end of the day. Vein disease can also cause restlessness of the legs and cramping of the legs at nighttime. And oftentimes, vein disease is a source of leg swelling as well.
So it's definitely not just a cosmetic problem. It sounds like it can be very painful.
Yes, it's actually, varicose veins is more of a symptom of a more serious underlying condition called chronic venous insufficiency. In normal veins, there are one-way valves that help to move blood from the legs back to the heart, which is the right direction that we want the blood to flow. And they work in conjunction to our calf muscles, which act as a pump. But in people with chronic venous insufficiency, those valves become quote-unquote leaky, and they don't work anymore, and lead to the blood pooling in the legs, which then results in symptoms.
And you have a facility in Olympia Fields. I assume people can come see you to figure out what they may need or what is causing their pain. And if it's something that needs to be looked at, how does that get treated?
Yeah, absolutely. So fortunately, vein disease is very, very easily diagnosed with an ultrasound that we do in our office. And conceptually, what we do is if you have bad veins, we don't want them around anymore. So what we do is we shut them down. And we shut them down with a procedure that is minimally invasive. It's not more than an IV poke in the leg. And they're very safe procedures. They're done in the office. And there's little to no downtime.
I was just going to ask about the downtime. So it sounds like you don't have to really take off much from work or daily activities.
Not at all. The procedures last 10 to 15 minutes. Sometimes you can get them done during your lunch break.
Oh, okay.
So if this is something that, let's say, runs in your family, is there a way that you can step in and do things to prevent anything from taking place earlier?
Yeah, actually, I do have some strong recommendations for patients who do have risk for this kind of problem. One is if you do work in a job where you're sitting or standing for long periods of time, I highly recommend that you incorporate some sort of intermittent activity, whether it be just getting up, walking to the water cooler, going to the bathroom, walking around the halls. It's really important to get that calf pump working so the blood is flowing in the right direction. Also, I do recommend compression stocking use. They're snug compression stockings that collapse the veins so that if you do have leaky veins, blood's not pooling in your legs and causing those symptoms. And really, for women who are pregnant, I really recommend that they wear them early on. And lastly, actually, this is more for women. If you can try to minimize the use of high heels, that helps
I was wondering.
as well. Because using
Stop it right now. Really?
Using high heels negates that calf pump function, and so the calf can't empty out the leg as well as if you're not wearing them, and that can lead to some serious problems in the future.
I do wonder, is that why after you've worn heels all day, sometimes you have kind of that pain in the back of your calves?
Yeah, that's soreness and that throbbing. That may be from pooling of blood in your veins.
Well, there we go. Doctor.
Learn something new every day.
Yeah, thank you so much for being with us.
You're welcome. My pleasure. Thank you for having me.
For more information on the Vein and Vascular Experts, just call the number on your screen. And they have a special offer, free vein screenings in December with qualifying insurances.